the best way to minimize the amount of muscle mass that you lose during a weight loss program is approaching your weight training from that muscle building perspective. My goal is I want to build muscle mass. And we know if you want to build muscle mass,
So what do you really do for women to help them see that it's a lot more than just the scale? Because truth be told, who sees the scale? It's you and the medical assistant at the hospital or the doctor's office who puts you on the scale.
Lifting weights, resistance training is not only insanely important because of all the benefits we talked about on last episode regarding muscle mass, but your bones. The best thing you can do for your bones is resistance training,
right?
Because it causes that pressure of the pull and push, which is what you need to move.
And I do know that HIIT training is the number one way to increase mitochondrial density. Literally the number of mitochondria in your body and how your body can transport energy.
Lifestyle, resistance training, protecting your health, lowering inflammation levels. That's the best way to help osteoporosis. And how about this? How about we prevent it from happening to begin with?
Yeah.
How about that's the goal? The goal is...
So last week when I talked to you, we talked about the state of affairs in the healthcare system, the rise of diabetes. On Tuesday, we talked about the approach towards working out and exercising, getting to a point where you feel successful. The very next day, Scott Galloway went viral. There was a video called "Do We Love Our Children?" or something like that. And he had made a comment about the industrial food complex getting you addicted to food so they could hand you off to the diabetes complex. And obviously that made its rounds, and it was just so topical for what we were talking about. It seems like as we get more unhealthy, everything else starts to go in the wrong direction simultaneously. Have you noticed that?
Yeah. No, I mean, I'm glad somebody finally freaking said it, because it is... You start talking about categories and things of this nature, you start sounding like what they call conspiracy theorists. But I think the whole concept of conspiracy theorists is unfortunately a way to scapegoat people that are actually trying to speak up to something that might be a problem. At this point, you can't even speak up about a problem that might exist within the powers that be without being without fear of being persecuted, possibly even prosecuted. And, you know, it's a shame. It's a shame, because what the hell happened to freedom of speech? What the hell happened to us being able to speak up, have the right to say what we think might be wrong? And we might be wrong about being wrong, but we're not even being we don't even have the opportunity to be wrong about being wrong. What kind of shit is that?
Yeah. And I just thought it was, at the very least, you have a lot more people today kind of stepping into the fray, putting themselves on the line and speaking up. So I do think that there is a lot of change that's occurring. And I believe the last topic we left off on was resistance training. And we were talking about women and weight training, which I do think is something that we want to expand on, just because of the prevailing predisposition that a lot of women have when it comes to weight training.
Yeah, no, I think this is great. And I spend so much time with our patients, with women, just educating them and almost convincing them to lift weights. I mean, literally. With men, you generally don't have to. With some men, you do. But, you know, and I mean, that makes sense, right? Getting into the whole gender roles from a kid, the idea of a male. I mean, look at the ideal of a male physique, right? It's a lean, muscular physique. And depending on what country you're in, there's probably different ideas for female ideal physiques, but neither of them are muscular. So I get it. And it makes sense where this resistance may come. But the reality of resistance training for women is that it is just as important as it is for men. And in fact, I would actually argue more important, because of the simple fact that women do have to work significantly harder to build muscle mass. Women do have to work significantly harder to maintain muscle mass, especially when they hit menopause. And we'll talk about osteoporosis in a little bit, but women have to prioritize resistance training because their bodies are going to give them so much more grief in order to build and maintain the muscle mass. So it's absolutely crucial that women understand that they need to lift. And the way I approach the mindset towards lifting, and this actually goes to men as much as it does towards women, is we have to treat resistance training when I'm in a, because we're talking about the context of a weight loss program, right? We're talking about the context of I'm in a lasting weight loss program. I'm trying to lose weight. So it's so common for both genders, more so women, to, oh, I'll just start weightlifting when I hit my weight loss goal. It's like, oh my gosh. And I know we talked a lot about the specifics in the last episode of resistance training and why it's so important to not do that. But I just really, really want to highlight that again, that in order to, you're going to create so much more work for yourself if you lose 50 pounds and you didn't resistance train, because the percentage of muscle mass loss is going to be way higher if you don't resistance train. And for women, it's just as big of a deal. So we have to groove this in. And the best way to minimize the amount of muscle mass that you lose during a weight loss program is approaching your weight training from that muscle building perspective. My goal is I want to build muscle mass. And we know if you want to build muscle mass, you increase your protein intake, you increase your calories to a slight surplus so that you're actually looking for the scale to move up. And then you structure your workouts with a certain intensity and you train within a certain rep range and the volume and yada, yada, yada. But then all of a sudden, when we talk about working out for weight loss, all of a sudden the shift is higher rep range, higher intensity. Well, intensity should always be good, but higher rep range, lower rest. And so the caloric burn is very, very high. And I'm not saying that we shouldn't be training like that, but when we only train like that, then we will have a greater degree of muscle mass loss during the weight loss program. And so I think I bring this up because women tend to fall into that category. You know, the classes, the aerobics. I think Orange Theory. You have a lot of these different gyms. What's the Curves, right? Curves women only gym, and they're promoting this kind of idea environment, tailoring obviously business wise to what women want to do, but there's the reality of what works best, and we just have to get through this barrier. And if you are looking to achieve lasting weight loss, you need to train like a man who is trying to build muscle mass. And that's just like a man, any person. I guess I should be careful nowadays. Labeling, I don't even know what I can't say when it comes to genders. But you need to train like an individual who is trying to bulk up or get jacked up. I always make that joke too as well because of the benefits that we just talked about.
Okay. Before talking about women and menopause, will you get into how you feel people should self-assess or self-measure? William, he was listening to a conversation I was having yesterday with somebody, and right off the bat, she was telling me her BMI. And it's funny to me that doctors still use that, but I had to kind of explain to her. I said, look, you could be a male and let's say you're 5'11" and 220 pounds. You could absolutely be clinically obese, or you could be an NFL running back at 10% body fat, and so that is just not a good metric. That should not be your barometer. Between going to find a hydrostatic, electrical impedance, like what would you say are the best methods or the best method towards just finding out exactly where you're at?
Yeah, so it's tough. It really is tough, especially, with us being telemed and servicing across the nation. I honestly keep it so simple because the less things I put in front of the patients that they need to do, the better. So we use weekly weigh-ins, and we use weekly weigh-ins as sort of 1 degree of change. And when we're talking about people coming in that are overweight, massively overweight, obese, morbidly obese, just seeing that scale go down, I know we're moving in the right direction.
Right.
We are losing enough body fat percentage. And then obviously, we don't know how much muscle mass they're losing along that body fat. But what we do know is the higher body fat percentage somebody has, without looking at any other variable, just that variable alone means that you will lose a higher percentage of fat mass. It's not until they become leaner that the other variables start to play a bigger role. So the other thing that we do that I have found to be very effective is pictures. So we instruct our patients to take pictures, a front view, a side view, and a back view. Not every week. I think that's a little bit too much. Every 2 weeks. If you do it every 2 weeks, you have this setting where you take the pictures, and you can yourself or a loved one or a partner or your coach, whoever's guiding you or supporting you, can take a look at those pictures and be very as objective as you possibly can, because this is still a subjective thing. And looking at your body and looking for visual changes in the right direction. Because if we are not, as the scale is moving, right, we are hoping to accomplish a greater degree of fat loss and minimal muscle mass loss. So if that is happening, you should see changes in the size. Once you hit a certain body fat percentage, you should start to see some increases in tone, increases in definition. So this is where the pictures can come handy to be very objective. And then the third category is just, how are your clothes fitting? How are your clothes fitting? Your clothes should be getting looser. And that's another indication that we are dropping body fat and that we're moving in the right direction. Once we start getting patients that come to us that are already in a healthy body fat percentage, and then they want to get leaner, it gets trickier. It does. You don't see the clothes move as much, although you do. That's where the weekly weigh-ins kind of come out the door, because you can stay at the same weight, but then really start to shift the body composition. And we have a lot of patients that do that too as well. So I think for those ones, pictures really become the best objective measurement. I'm not a fan of the electrical impedance. So electrical impedance, that's the type of body fat measurement where you can get a scale for $20. And I see them all the time. And, it's unfortunate that people do that, because they're so horribly inaccurate that I have not found any scale at all that I'm comfortable with, that I recommend, because I think the inaccuracy throws people through loops more so than it can be beneficial. So I stick with things that are more reliable. And I'm currently working on a system of calipers. So calipers are kind of old school, but calipers are actually very accurate when the person that's using them is trained up enough to understand how to do it. And then you have to have the same person doing it so that they're consistent. Because with the calipers, it's very easy. If someone else comes in who's also highly trained, they might just have a slightly different area that they do. So if you have somebody who's good enough at the calipers, because those are cheap, you can buy a pair of calipers for a couple bucks, right? So what I'm working on is this cool little system where it's not the calipers that I'm worried about them getting, but it's training, right? Some sort of telemedicine training where we can get somebody comfortable to do the calipers. Then all you need to do is get your partner to be good at the calipers, and then they can be your go-to every 2 weeks. That would be awesome. I'm working on that. And I think that would be one additional, probably that would probably become the gold standard among the pitchers and among everything else.
Yeah, I do like calipers. There's a 4-pinch method, a 12-pinch method, a 20-pinch method. It does leave room for user error. At the very least, if it's the same person doing it, it's that same micro error.
I think so. That's why that's so important. It's got to be the same person doing it.
Yep. Now, again, back to women. Pound of muscle is about the size of a tennis ball. A pound of fat, about 3 times as big. Picture a beach volleyball. So we know if you're building muscle or if you're losing fat, even if the scale isn't changing radically, the inches are going down. That's just what happens. How do you get men too, but more women, just in my experience, how do you get them away from focusing just on that number on the scale? Because there will come a point where, look, a woman who's 5'9" and let's say 140 pounds, it might seem heavy, but I've seen heavier and really lean and really great looking. And that's the physique that they can maintain, which we haven't even talked about yet. So what do you really do for women to help them see that it's a lot more than just the scale? Because truth be told, who sees the scale? It's you and the medical assistant at the hospital or the doctor's office who puts you on the scale. That is it. Nobody walks up to you like, Sandy, oh, you've gained 2 pounds, right? It's about how clothes fit. We all know that.
Yeah.
So it's like, how do we actually acknowledge it?
Yeah, I think that we want to focus on kind of one thing at a time, right? Starting a weight loss program, it's already overwhelming enough, right? So I do tend to stick with the scale in the beginning. Again, the exception being someone coming to us who's already in a healthy body fat percentage and they're looking to get more of that fitness. That's probably one fifth of our business is people like that. And I honestly, the men, I just say copy what I'm doing, and we should do a whole other episode about what I personally do. But for the majority of our patients, they are in that heavier, obese, sick category. So again, I don't get too much into fixating outside of things.
Mm-hmm.
I want to minimize the amount of stuff that they need to do. I want to give them wins. I want to get them motivated. I want to get them happy. I want to get them moving. Then once we start getting to a point where they start getting closer to that weight, it's going to be different for everybody, right? Because there's so many variables with how much muscle mass they have on their body, how much are they lifting, things of that nature. But once we start seeing a slowdown in the rate of their weight, and we rule out weight loss plateaus, then we dig into where they're at, their height, their weight.
Mm-hmm.
Okay, so pictures. Okay, we can tell their body fat percentage is actually closer to the area where now we start shifting off of weight loss mode, and then we start shifting into recomp mode, and then that is going to play into their goal, right? So there is a certain amount of muscle mass that everybody should shoot for health. And then there's athletic look, performance, and just being, again, the look, right? And some women do appreciate and want that more athletic look. Most of my men do, obviously. Most of my men go, and I hear this all the time, and I love when we can help both men and women achieve the desired physique, whatever it is. If it is muscular, if it is kind of that lean in tone, we're going to help guide them. But it's getting them from that overweight category, getting them from that to this area where we can then kind of shift the perspective and then start focusing on other things, which at that point is going to be more pictures, more calipers. If I can get a system for getting that out there, and kind of staying away from the scale.
Yeah. One more thing on that point, frequency. There's different approaches towards it, but when you weigh too much, when you measure too much, when you look in the mirror too much, it tends to mentally significantly slow down the rate of progress because it's just too many measurements. And it'll take away from what you think is happening and then stall you. So what would you say is a healthy amount of
measurement of some sort? Assessment?
Yeah, self-assessing.
Yeah. It depends on whether you're in maintenance or whether you're still striving toward. That's the big thing. If you are striving towards a goal of body fat loss, I think there needs to be more consistency with your objective, or as close to objective as possible, measurement, right? So the weekly weigh-ins are solid. We'll do that with our patients once per week. We're very strict about the time of the week, the consistency in the morning before you pee. Boom, done. You're good. Now again, it's going to change and shift once we get down beyond that and we start getting into the more recomposition. But I think once a week is good for weigh-ins. I think pictures every 2 weeks. That's kind of where I think is a good consistent. Now, once we get to the lifestyle, which we call our program for patients who are maintaining weight, we call it the flow lifestyle. And so for our flow lifestyle group, I think pictures once a month is good. I think weekly weigh-ins at that point, it's up to the individual. What do they feel comfortable with? I want a minimum of every 2 weeks. But if they're so grouped into doing once a week, I'm okay with that. So now it kind of becomes a little bit more flexible to if it's annoying for you, but you think you can do it every 2 weeks, great. But if once a week is no problem at all, I would stick to that. I mean, look, some people like counting their calories, right? It's 0.1% of the population, probably, if not less, maybe 0.01. But some people do. If you like counting your calories, freaking do it, because you have an insane advantage over everybody else, because you can actually know, roughly at least, what your energy intake is. So it gives you a lot more control. But it's obviously not sustainable. And so forcing someone to do that, it's never going to work. So I have patients that weigh themselves every day. And if you are going to weigh yourself every day, the only way that's going to work is if you actually understand the concept of the fluctuations. And this is where I'm like, I do have a couple of patients that come to mind. And so they have an app where they plug it into, and the app gives them the graph. So then they can zoom out of the graph and look at it, and they still end up looking at the trends. But, so at the end of the day, there's that minimum frequency that I like, but we have to tailor that and mesh that in with the comfort level and the desire of how much effort the person wants to do towards that particular thing.
Okay, that makes a lot of sense. Now, now steering into more function and health, bone density, obviously important for men too. I actually really like, I don't know if it's a gym, clinic. There's a company that popped up, Osteo Strong. I have no affiliation, but from what I've seen, it's all about a lot of slow contraction, right? A lot of eccentric, negative movement where you're just really focusing on the load. A lot of isometrics, a lot of static, right? So you have people, even with previous injuries, I was going to say where you're reducing risk of injury, but some of these individuals already have them and they're still able to work through. It's just a great way to support your body's structure, especially if you're new to it and maybe elderly. But for women, we talked a few weeks ago about one of the main fatal incidents for women being a fall, one from lack of proprioception and neuromuscular control. So their stabilization within their body literally isn't as highly functioning as it should be. They fall, they break, they can't heal. But the break itself is that second part. And women really get the short end of the stick when it comes to bone density and osteoporosis and the need to really, really focus on preventative methods.
Yep.
Right. So what do you have to say about that?
Yeah, osteoporosis is a real problem, especially in menopause. The medical definition of menopause is 1 year not having a menstrual cycle, but really, menopause signifies the state for a woman where that's it. They're no longer going to be passing the egg to be able to prepare for pregnancy. So with that, we see a dramatic drop in sex hormones, estrogen, progesterone, but specifically testosterone too as well. Now, these hormones themselves play some direct roles in osteoporosis. And so to define osteoporosis, we're talking about the demineralization of your bones. A lot of people get osteoporosis confused with osteoarthritis. Osteoarthritis is a completely different condition that has to do with breakdown of the cartilage in your joints. Osteoporosis is actually a weakening of the bones. And so postmenopausal women have a much higher rate. Specifically, Caucasian postmenopausal women of all races have the highest rate. So we definitely should make other episodes talking about hormone therapy because getting on testosterone can have a huge impact. But it's not the testosterone directly. It's the combination of testosterone and resistance training. So this is always, I find a lot of people are very intrigued with this because how does resistance training, I get the concept of my muscles, but how do the bones get stronger? Well, if you think of your body's structure, and it's actually, you really, really get into the fine tune. If you imagine a skeleton with just a bunch of muscles on it, it's an insane amount of levers, right? And each joint allows the bone to move in certain planes of motion. And then you have muscles that are attached from one side to the other. And then the muscles contract. And when they contract, they're pulling over the lever. And it's really cool when you really think about it. And that's all happening coordinated at the same time when you think. And anyways, it's pretty cool when you think about moving.
Quick side note, an old boss of mine said the human body is the only machine that gets better when used correctly with use.
Yeah, seriously, because of the adaptive response and the neurology. And then you have the whole nervous system, right? That's intertwined, controlling all that. Anyways.
What machine could I give you today that in a year after using it every day, it'd be better?
It gets better. No, we don't have that. And that's kind of scary to think about when we do. But AI is a whole other thing. So anyways, when we think about the muscles pulling, as a muscle contracts, it pulls on a bone. Well, that pull, or push, I'd say, because you have muscles that pull and push, that pressure on the bone is a stressor. And so that stress is a force, and that force acts on the bone, and the bone has to react to that force. It absorbs the pressure, right? It absorbs the force. And so the reaction from that is a strengthening response because you are stressing the bones. This is why you've seen, it's rare, but lifting insanely heavy weights, heavier than you should, most likely will snap a ligament or a tendon, but you could break a bone depending on the particular lever and the motion and how you handled it. But bones can snap, and this happens more often in elderly, sometimes when they go lift weights. So lifting weights, resistance training is not only insanely important because of all the benefits we talked about on last episode regarding muscle mass, but your bones. The best thing you can do for your bones is resistance training,
Right.
because it causes that pressure of the pull and push, which is what you need to move. So, and move through the resistance. So walking obviously is a starting point, but walking is drops in the buckets to solid resistance training. And then when you optimize with things like testosterone, and we have women's health practitioners, we've been helping women for the last decade. What a difference it makes for men and women when you optimize your testosterone levels to a healthy level, to the optimal range. Now, when you perform resistance training, you get a much faster recovery, you get stronger faster. And that not only is psychologically motivating to keep the lifting fun and to keep you progressing, but then that makes a powerful impact on the progression of bone health. And those medications they're awful. Those medications, we should probably do another podcast talking about those and maybe just some of the more common medications. But those medications are literally inhibiting certain osteoblastic and certain osteoclastic activity, which in many cases, I'm not making the argument saying this is a fact, but there is a belief and an understanding that a lot of those medications end up actually making bones weaker. Weaker, not stronger. So I'm not making that claim right now, but I have seen a lot of literature. I don't spend as much of my time focusing on bone studies as much as I do with weight loss, but very, very interesting and intriguing stuff, and intriguing that could be not the best route. And my philosophy has always been reducing prescriptions, preventing surgery. So I don't even need to dive into that deeper, because the only time I'd potentially think someone should do that is if they're in a state where their bones are so weak, and that's the starting point. But lifestyle, resistance training, protecting your health, lowering inflammation levels, that's the best way to help osteoporosis. And how about this? How about we prevent it from happening to begin with?
Yeah.
How about that's the goal? The goal is menopause is around the corner, ladies. So let's get strong now. How about you never go down an osteoporosis count? You're getting your bone, you're getting your DEXA scans, you're seeing what the mineralization content is of your bones. So you're getting your DEXA scan, and as you should when you hit a certain age, some people say 40s, 45, somewhere in your 40s, you should be getting a DEXA scan once a year so that you can see the mineralization content, the strength of your bones. And how about you make a game for yourself where you're looking at that number and you are doing everything you can to keep that number from regressing too much. That to me would be the ultimate approach towards keeping your bones healthy, and you make a game of it. But what I have to say about that.
Lifestyle, you said. I think we should change. One, let's change healthcare to sick care. Let's just call it what it is. We help you when you're sick. And two, let's change lifespan to playspan.
Right.
Lifespan means nothing if you're an invalid or in a wheelchair, have lost all bodily function by the time you're getting your AARP card, right?
Yeah.
I want to die just as mobile as I am today. And I do think that should be everyone's goal.
100%.
Now, ROI. A lot of us are busy. Everyone's busy now, especially with working 2-3 jobs that I hear about. HIIT training. I've, for years, had HIIT training at the top of my podium, just in terms of what it gives you for what you put into it, the amount of time that you have to invest for what you can get out of it, what it does for multiple systems of the body. Case in point, look at any Olympic sprinter, right? And you tell me. Let's talk about HIIT training and how you approach it towards weight loss maintenance.
I wanted to interrupt for a quick second and tell you guys about the free weight loss plateau busting guide that you can get. I'll link to it in my description, guys. I break down the exact steps of what you need to solve that dreaded weight loss plateau, and more importantly, how to prevent it. Now back to the show. Yeah, no, I'm glad you brought that up. And I want to say this, for anybody listening that's already in my coaching programs, you guys know that I always put HIIT training as number 2. And we're going to talk about the various forms of HIIT training. There's one form that is significantly better than the rest. But even with the most significant form, I always prioritize resistance training. Now, could there be an argument in a scenario where resistance HIIT training would come first? I think that would be very rare. For our protocol, we have our patients doing so much long fasting every single week that they're getting the majority of their caloric deficit. They're getting powerful hormonal responses. And so in that scenario, resistance training is number one. If we're talking about an individual who's doing nothing and they said, look, I only got 20-minute 3 times a week, I might even say HIIT training is to be better. I just never find myself saying that because I'm usually doing it in the context of working with people in my program. But applying this to everybody, this is how powerful HIIT training is that there could be a potential argument for it actually being number one. And I don't think I would ever say that, but you just kind of made me think about that right now. So, okay, let's dive into this. From a general perspective, HIIT training is a concept of just alternating between higher intensity, so any form of exercise, really. It's not particular to one type of exercise. Any alterations between higher intensity, lower intensity. For example, I'm jogging on a treadmill and I crank up the speed to a speed that I can jog, whatever that is for the individual, or maybe even walking fast at an incline too. Same thing. I crank up the intensity and I go harder for a minute. Now my heart rate's too high. I cannot maintain that intensity. So then I crank it down to some sort of lower intensity. I rest. Even if it's so high that I had to take a whole minute off, okay, which means the intensity was even higher. Great. That's a higher version of it. That's a more intense version, but the concept is still there. 1 minute on, 1 minute down, 1 minute on, 1 minute down. There's benefit to that. The literature is very clear that there are benefits to doing that. But let me talk about the most effective form, and then we can compare it back to any version of this, because there's so many versions of this. And again, remember, it's not particular to any sort of exercise. It could be a weightlifting particular exercise that you do in a more aerobic fashion that could still kind of follow this pattern. So, and this is there's a great book called The 1 Minute Workout by Dr. Galbera. I think it's Dr. Galbera. Hopefully, I'm not butchering that. Galbera.
Hey, sorry, man.
Yeah. Hopefully, if he's watching this, but phenomenal book called The 1 Minute Workout. Now, it might be slightly misleading because you're still going to be working out for 15 minutes, but his concept of the one, very catchy, because the actual intense part of the workout is only 1 minute long. So check this out. From his research, what he's saying you do is after you warm up, you get a warm up for about 3 to 5 minutes because you're about to go 100% intensity. Now, again, the exercise doesn't matter because you're going to have so many levels of fitness. For example, me and you can go sprint, right? Although I say that lightly and candidly, sprinting sometimes puts me. I have to actually be in shape, so I'm not trying to brag by any means. I'm not in my 20s anymore. Being able to sprint in your 30s and older is an accomplishment. So, a fit person that doesn't have injuries or pains other than the normal sort of muscle burning that happens could go sprint. But for your average person going out there, this could be swimming. Swimming would be great. You're hitting it as hard as you can on that lap. Think running from a tiger, or I guess swimming from a tiger if they were coming at you. Swimming from a shark, I guess, is probably a better way to say that. So you're 100% intensity. And I'm taking a lot of time talking about that because it's very quick to just assume 100% means we'll go harder. No. If you could hit 30 seconds and you truthfully were not at the point where I have to stop because I think I'm going to keel over, you probably didn't go hard enough. Another way to look at this is if after my rest period, because he wants you to go from 20 to 30 seconds max, followed by a 3 to 4 minute rest. Rest, as in you are standing there or very slow walking. If you felt like after 2 minutes you were ready to go, you did not go hard enough. So this is a very intense form of exercise. And I'm not saying everybody, and neither does he in the book, should immediately go to this. If you can't go to 100% intensity because you feel like you have, well, first of all, if you're aware of any cardiovascular conditions, always consult with your healthcare practitioners. But you work up to this. You go to the heart. You go to the closest to 100% that you can, right, without feeling concerned about your health. And you get so wherever that is, as close as you can get to 100, and then you rest. But as long as you don't have any pre-existing conditions, you can train and eventually get to a point where you are at 100 and you're stopping, not because you think you're going to have a heart attack, but you're stopping because you are literally out of breath and you literally can't go anymore. And so sprinting is just, but you can do it with swimming too as well. So you warm up, you hit it for 20, 25 seconds, you rest for 3 to 4 minutes. That's one round. And you do that. The first time you do this, 3 rounds is plenty. right? 20, 40, 60 seconds.
Mm-hmm.
And then eventually you can start working up to 4 rounds, you work up to 5 rounds. But the 1 minute workout really means, if you think about it, 3 rounds of 20 seconds, all out intensity. That's your 1 minute. The hormetic response from working out like that is unparalleled.
Mm-hmm.
When you look at what cardiovascular would do, when you look at even other forms of high intensity, because remember we talked about high intensity could be 1 minute on, 1 minute off. Just think about the intensity difference. If whatever you were doing for a minute, if all you needed was a minute rest, that is significantly less intense than whatever form of exercise you couldn't do past 20, 30, and you needed a full 3 to 4 to recover. That's true high intensity workouts. Growth hormone levels skyrocket, testosterone improvement. So this is the best form of working out. And if you're an athlete, you do this regularly. If you are, and I know a lot of us are not, right? So, but if you are playing competitively in some sort of sport, you do this. You have moments where you are going high intensity for X amount of seconds, and then you're resting, and it's significantly longer than 5 minutes. But for your average person that is not doing this, this can really take your workouts to the next level. More importantly, this can take your health to the next level. So the hormetic response is massive. So you actually have some stimulus towards your muscle mass because of the hormones. But then this concept called EPOC, excess post-oxygen consumption, is very massive, where for the rest of the day, you will burn more calories at rest. You get this a little bit from weight training, but you don't get it nearly as much from weight training as you do from doing this specific 1 minute workout style, which again, it's going to take you about 15 minutes or so to finish it. But that's truly the best form of 1 minute of high intensity interval training. I tell our patients, if you are working out 3 days a week, perfect world, you could do this the other 3 days. So now you got something physically 6 days a week. But if you can't, scheduling wise, if 3 is still the only amount of time you can allocate to working out, do that right after your weight training session.
Mm-hmm.
You talk about progression in your fitness level. Actually, I'm so excited to start sprinting. A lot of people don't know. I mean, I've been dealing with this knee thing. Phenomenal progress with the knees over toes protocol. And I'm playing volleyball right now, but sprinting is actually above volleyball. So working with my PT and working with the guys at K over T, the knees over toes protocol, I'm actually ready to do my first rounds of sprinting and start progressing myself. So I'm excited because I'd like to be able to continue sprinting as something I do on and off for as long as I can because of the benefits that sprinting does. But sprinting can be very tough on the body. And this is why I love K's over T's, because he, not to tangent too much on that, but you train from the ground up and you get your body able to handle these more rigorous types of activities. And if you continue to perform rigorous level of activities, you stay at an elite level of fitness. So anyways.
You unlocked the core memory for me. Back in 2012, I was the fitness director at LA Fitness in Mission Viejo. My dream job at the time, it was the flagship club. I had just really gotten into HIIT training, and a buddy of mine and I, I'll never forget this. It was 8 rounds of a 45-second sprint on an incline on a treadmill with a 1.5 minute rest. And you really made me remember this when you said start easy. I completed the workout. I made it down the stairs, and there was a pillar at the bottom of the stairs. I crashed against it. I didn't come back from my lunch break right away, and I gave my next appointment to my assistant manager, Kayla, because I was dizzy and so deconditioned. I mean, it was to this day, not being ready for it, one of the hardest workouts of my life. But I will say about 3 weeks later, doing that consistently, it was night and day. And I do know that HIIT training is the number one way to increase mitochondrial density, literally the number of mitochondria in your body and how your body can transport energy. So if anyone's out there just really looking to get in it, it doesn't matter what your conditioning level is. Your maximum intensity is your maximum intensity, and that's what it is. And you know how hard you're pushing yourself.
Yeah. No, I'm glad you brought that up, because there's a lot of more attention on mitochondria, especially with this powerful peptide MOTS-c, which is this really cool peptide that is actually repairing mitochondrial DNA.
Mm-hmm.
And the fact that mitochondria have DNA is very, very fascinating because we look at a cell and the cell has the nucleus, which you can kind of think of as like the brain, sort of, and the DNA is inside the nucleus, right? And the DNA is responsible for essentially the blueprint, the transcription, the production of all the different tissues and organs in your body, right? But no other area of the cell has its own DNA, but mitochondria does, right? So that's, we don't know why, other than it's probably really important.
Mm-hmm.
and the mitochondria is like you said, the batteries, the powerhouse of the cells. This is where all energy utilization starts at. This is where we get our usable energy in the substrates that we consume.
Mm-hmm.
When they're broken down to the smallest units that can then be converted into energy. It all happens within mitochondria. And there's some literature coming out where they're starting to look at the mitochondria as the base of all disease pathology. So anyways, we should definitely talk about MOTS in a later episode, but a lifestyle thing that you can do to increase mitochondrial density is going to pay dividends.
Okay. So got to work on the cardiorespiratory, got to do the resistance training. All of this leads to weight loss, weight maintenance, peripherally. You hear about red light therapy, soft tissue work, UV light, grounding. What should people be doing day to day, week to week, that is around their activity that you see as being pretty up there as well?
Yeah, I think my philosophy. It's always keeping it sustainable, and I really stress that because it's really easy for people to get overwhelmed.
Mm-hmm.
You hear about 1,000 supplements that you got to take them all, right? And then there's 1,000 different workouts, and they're all great for you. It's like, it's really easy to get overwhelmed, and so I'm okay with them doing just resistance training. And then we add HIIT training if you have time. And then after that, for my do-gooders, and I think this is great. If you have the time you should absolutely do that. And there could be a case for people who actually require a higher aerobic capacity. Aerobic is now that steady state category. If you play a particular sport or you have a reason to have a high aerobic capacity, then by all means continue to do that. But when we talk about, again, just lasting weight loss, general public, aerobic capacity training is certainly lowest on my list.
Mm-hmm.
For many reasons, but one of them is you actually get a ton of aerobic capacity improvement with just the HIIT training, for example, because you are, for the entire 4 minutes, you are literally breathing as hard as you would be when you're doing steady state cardio. But in any case, there are certain zones, and there's a lot of literature behind zone 2 cardio. In fact, I know we were having this discussion, and I'd love to hear you dive into zone 2 cardio. What exactly is it, and what sort of benefits can we expect from that? Because that would be the third category of cardio, a third category of exercise that I would recommend to people who have time to be able to allocate it.
Yeah, so zone 2 is really specifically related to your endurance. And more importantly, it increases your VO2 max. So does HIIT training as well. But when you incorporate zone 2, and you need to do at least 45 minutes per session for it to be effective. And ideally, you want to do, especially if you're new to it, at least 3 times a week, really 4. If you're already conditioned, you can get away with doing it twice a week. But when you're working out, it's pushing yourself to the point right before you're passing over your lactic acid threshold. And the best way to know this without actually having to invest in any devices,
like a heart rate monitor.
Yes, yeah, is a talk test. If I'm on the phone with you, or if you're on a conference call while you're working out, if nobody on the phone can tell that you're working out, you're not working hard enough, right? So they can obviously tell that you're breathing heavy. But if you can't talk continuously, if you can't talk in a straight line, you're going too hard, right?
So let me make sure I understand that, because I do a lot of my treadmill when I'm doing some of my calls, and I'm definitely training probably zone 1, because I don't want people to know that I'm essentially exercising. Sometimes they can hear it, but for the most part, I feel unaffected. maybe at peaks of high intensity of a particular conversation, I can catch myself for one breath being like, ooh, like I was a little bit winded there.
Mhm.
But yeah, it sounds like what you're saying is zone 2 is it should be pretty easy for the other persons to perceive that you are working out,
Mm-hmm.
but it shouldn't be to the point where you can't continue the conversation.
Exactly. You're labored. It's not something that you want to do, but it's not a struggle to talk.
Okay.
Right?
Okay,
You know when it's a struggle to talk when you have to pause to catch your breath consistently.
Okay.
Right? But as a tangent to that, going back into what you need to be doing in the gym, or at least with your body outside of pushing weight and pulling weight, it's the soft tissue work. You please do not avoid the soft tissue work, and it cannot just be stretching. You need myofascial release. Like go to
Foam
the
rollers.
Yes, yeah, foam roller, lacrosse ball, tennis ball. Go to the gym, buy a steak, take the peel off. You can actually pinch it and pull a little clear layer. That's fascia, and it's like Saran wrap. It can knot up. And if if I took out my shoelace right now, I tied it in a knot in the middle, and I took that shoelace and I pulled it at both ends. What's going to happen?
Gets tighter.
Exactly. So that knot's not going anywhere, right? So you actually need pressure to relieve that. So you have people with piriformis syndrome, with iliotibial band issues, and they'll come in thinking they need knee surgery. They've had issues for years. You'll foam roll for minutes, and immediately, not only do they have more mobility, but they have less pain. More important than that, what are we doing right now?
We're seated. We're in the dreaded position where our hip flexors are shortened.
Okay, and K through 12, how often do we sit?
All damn, well, what, 2/3 of the day?
Yeah. When we're working on patient files, when we're doing any work, really, what are we doing?
Hunched forward and hip flexors tightened.
All right. When you're not talking verbally on your cell phone, how are you talking to people?
When I'm not talking verbally?
Mm-hmm. When you're talking on your cell phone.
Oh, yeah. Hunched,
Exactly.
Forward.
We're in a society where our entire anterior chain is just getting locked in. And the problem is every muscle has an opposite. You have an agonist and antagonist. If I contract my bicep, my tricep has to extend, vice versa, correct? And these balances play a huge role over time. And if you have an imbalance, it causes wear and tear on a joint. So you look at quad dominance, that is to say, people who walk around with quads a lot stronger than their hamstrings. And you know this because when they walk or when they squat, you'll see the toes turn out, some external rotation, and the knees will buckle in and a tilted back. Now, if you let that go on for years, what's going to happen is your likelihood for knee surgery is incredibly high, right? Same goes for the hips, same goes for the shoulders, the cervical spine. One of my favorite things to do is to tell people when you're sitting down, put your neck back. But you tell people that, and what do? They go into extension. Right? So instead, let's say you're at a Denny's and you're a spy and you're spying on the family behind you. You wouldn't turn your head. What would you do?
Retract it.
You would engage the levator scap. You would retract. And it's learning those tools, roll up a towel, lay down, put it behind your knee, do scap retraction. Things like that are minor and they're easy. But over the course of time, you will prevent the wear and tear, the aches and pains, the injuries that lead to surgery down the line. I can almost promise you, if you just focus twice a week on foam rolling and then corrective exercise.
Yeah, I think, and I definitely think we need to do a deep dive into that. I know you're working on a virtual program for that in months in the progress, but definitely we should do an episode where we dive into that for sure.
Yeah, I mean, one last example. Probably the most common one is quad dominance. People do not work out their hamstrings enough. We all overuse our quads. That's why everyone walks around with knee pain by the time they're 40. If I, before you worked out, said, lay down, and I foam rolled your quads, you're actually relaxing the signal between your brain and that muscle so that when you do go squat, your body will actually allow itself to engage the glutes and engage the hamstrings and use that entire complex of muscles to then bring you back up. If you don't foam roll your quads and you get under that bar, guess what happens as soon as you drop down?
What?
Natural quad engagement, because that's already what your body is used to. So you first have to calm them down, and then you excite the muscle that you're trying to work. Then when you bring them together, they're going to work synergistically. And obviously this expands and goes into every muscle in your body.
Yeah.
There are a lot of kind of hot areas that are very common.
Very common.
But if I had to whittle it down, work your hamstrings more, get some bands, do some external rotation so you can bring your shoulders back.
Yeah.
And please do some core work.
Yeah, the hamstring work that I have found to be the most effective is, and it's tough. It's tough to get people into this, but again, if you're really looking and you have access to this, so I mean, any sort of hamstring work is going to be beneficial. But for people that are looking to really take it to the next level, finding a way to do Nordic curls is just insane. You talk about strengthening your hamstrings, specifically the part that's more connected to the back of the knee. What's cool about this is you can get for $40 on Amazon a little setup device where you can pop a little knob behind the door, close the door, and you can do Nordic curls like that. So you don't need a $500, $1,000 piece of Nordic equipment. I would save that for an investment when you actually get better at it. But yeah, the goal of being able to do Nordic curl is still on my list, and I'm making a ton of progress on it, and I've made a big progress on it. But yeah, Nordic curls, I couldn't agree more with hamstrings, and Nordic curls are definitely my go-to hamstrings. I would say that and standing Romanian deadlifts for sure.
Yeah.
But I alternate between that and definitely Nordics for sure.
And we talked about stability and proprioception today. Single leg RDLs. Right now, you're actually giving yourself that challenge of 360 to stability as well.
Right. Yeah, I agree.
I think we'll call it there, man. Some really good stuff. And I know next time I see you, we're really going to get back into going back to that YouTube video I talked about in the very beginning, man, how we can reverse the trend. Damn. I mean, just we're going in the wrong direction in so many different areas. And there are ways to fix it. There really are.
Absolutely. Yeah. No, I'm looking forward to that one, man.
All right. Thanks, man.
If you guys found this informative, then you're going to want to click this video right there. It's a continued explanation of what you learned today, guys. Knowledge is power, so let's keep this going. We'll see you later.